Hello and welcome to today's webinar. My name's Kate Field, but I'll do proper introductions in a moment. And today's webinar, we're going to be exploring whether management systems and certification really improve performance. So it's great to have so many of you in attendance. So just to kick us off, a few housekeeping elements and information for you. So you have joined a muted webinar, which means you should be able to hear us clearly, but we can't hear you. But we really want your questions, so do ask questions. Hopefully there'll be plenty of time at the end. In order to ask questions, if you look in your control panel, you'll see a questions and a kind of a chat box function. So if you submit your questions through that, we will pick them up either as we go through or, as I said, towards the end. In terms of after today's session, then you will receive early next week a recording of this session, so you get to listen again, and ideally please share it with colleagues and others who may be interested. And also, if you look in your control panel, you'll see that there are some documents that are available for you to download today, but we will also send those links back in the document. So that's the housekeeping done. So I'd like to do some introductions as best I can. Unfortunately, Michael's having a few issues, so he hasn't quite joined us yet, but we're hoping he'll join us soon. I take the pleasure in introducing JC, who's the CEO and co-founder of AccuZen. And JC is a startup and founder who is leveraging his professional experience to focus on people-centric digital transformation and doing some really amazing stuff, I have to say. And during JC's professional career of over 3 decades, JC has travelled extensively worldwide, so has a really understanding from an international point of view, and has worked across multiple industry sectors to really help them develop their quality, health, safety and environmental practices and broader risk management strategies, competency development and operational excellence initiatives. He's also credited with conceptualizing and launching several new service offerings during the course of his professional career, and most recently has contributed towards the development of the 3C, 3P framework for a resilient industrial safety system, which was included in a UNIDO publication on the subject, which we worked on, which is fabulous. So it's great to have you here today, JC. I'm going to do the intro for Michael in the hope that he joins us soon, but we are having some difficulties, in which case it will just be JC and I, but we'll still do a grand job. So hopefully Michael will join us. Michael is a managing partner at Clyde & Co, and he specialises in major industrial safety, disaster response and litigation. He has 25 years experience providing strategic crisis management and proactive resilience advice to companies around the world, and is the author of numerous books. Very good if you want to read on occupational health and safety law, and he's currently co-authoring a book on measuring safety performance differently, a part due diligence index with Professor Sidney Decker. I'm sure some of you will be familiar, and if you haven't had a look or seen anything about the due diligence index, it's a really great piece of work, and I'd encourage you to do so. And me, I'm Kate Field. I'm the Global Head of Health, Safety and Wellbeing. I had the honour of being recognised as one of the Safety and Health Professional Magazine's most influential individuals in health and safety last year, which was a great honour. And I've been working as a health, safety and wellbeing expert for over 20 years. And my experience crosses pretty much all sectors, public, private and third sector organisations as well. And I lead BSI's global strategy for creating a safer, healthier, fairer and more inclusive workplace. I started my career as a regulator before moving into consultancy, and now operate very much as a thought leader to really bring about cultural change that puts trust, engagement and well-being at the heart of everything that we do. So that's a little bit about your hosts, and it doesn't look like Michael's here yet, so we will carry on regardless, as the saying goes. So for those of you who Michael's here, or maybe not. For those of you who aren't Hi, Michael.
Apologies.
That's all right. It's lovely that you can join us. I'm sorry that things have been a little bit tense for you. Not a great way to start. So I'm gonna do a little introduction to BSI. So give you a few moments to catch your breath and get in the zone before we get into the webinar. But I'm thrilled that you were able to join us. Thank you, Michael.
Thank
So
you,
for
Kate.
those of you that aren't familiar with BSI, we are really the world's first national standards body. We created the first standard way back in 1901. And actually most of the largest standards available now, so for quality management, 9001, 14001 for environmental, and 45001, which we'll be talking about today for occupational health and safety, all have their heart in BSI. And one of the things that I'm most, oh, hang on, it's clicking the wrong way. I've lost my clickers. Oh dear. Um, so one of the things I'm most proud about working at BSI is that we are a change agent. We're here actually and driven by delivering change for the benefit of society. And that's embedded in the Royal Charter that we have. And I have to say that passion for making a difference in the world is really what's drew me to BSI, and what I love working in BSI for. And today, we are, as I say, a positive agent for change, and we're aiming to establish greater trust between a whole range of stakeholders, and bring all of those people together to really make a difference in the world, and particularly focusing on digital trust, sustainability and innovation. So that's a little bit about BSI. So I just want to set the scene for today's discussion. So I think I was talking to some clients yesterday, and we were talking about, kind of what's going on in the world, what's driving change, and kind of a renewed focus on people and health and safety. And there are a number of things, but the thing that came up loud and clear was COVID-19, the pandemic. It's really created a renewed focus on creating trust for our people. And I think that's because the corporate world rediscovered its humanity during the COVID-19 pandemic. All the hierarchical barriers, those at the top and those not at the top, all of that went because we were all in it together. We were all in this situation where we were potentially at home dealing with, dogs and cats jumping on the desk, or children coming in, and it really just kind of brought the humanity back to the corporate world. And one of the things that came out, BSI do a study on organisational resilience, a report every year, and kind of look at, what organisations need to be able to be resilient to not only survive but thrive in this ever-changing world. And one of the messages that came through loud and clear in the report for sort of, if you like, during the kind of what came through as the first year of the pandemic, 2021, was, those organizations that had really focused on their people, that had prioritized those people, were those organizations which were not only surviving but thriving, and they were weathering the storm most effectively. And actually that's echoed in the latest report that will be very publishing, the 2022 report, our second full year of the pandemic. And that focus and that need to focus on people is very much still with us, and the organizations that have done that most effectively are the ones that are now coming out and doing very well. And the sun's come out this morning, so I'm just going to close the curtains because I'm being blinded. So when we talk about creating a culture of trust, what does that actually mean? And I think one of the things that, and we'll talk about in a little bit more detail today, is in order to kind of really focus and look after your people, prioritize your people, there are kind of key elements that you need. You need a collaborative and communicative and emotionally intelligent leadership. This is always driven from the top, and we need our leaders to demonstrate those behaviours. You need to have a diverse, inclusive and ethical workplace where relationships are based on respect and fairness. You need to create opportunities for lifelong learning and employability. you need to say thank you, you know, in a way that is not just monetary. You know, so really thinking about what your recognition as well as your reward program is. And we also need to think about social value. So how do we engage within our organisation and the wider community to really create that social value and give back? And I think that is something that we become more and more aware of, and we're thinking about maybe as part of our ESG reporting. But actually, at the core of creating a culture of trust, and what we'll be talking about today, is creating workplaces that are free from physical and mental harm, and that actually promote good physical and mental and cognitive safety and health. And that's what we'll be looking at today's session. So I just wanted to give some context to today's session, and it would be great, in a minute I'm going to ask for your involvement and kick us off with our first poll. But if you want to understand more about how to create that culture of trust and the framework that you need, one of the documents you can download is BSI's Prioritising People model, which is a best practice framework for creating that culture of trust. And for those of you who have spotted it, it is based or inspired by Maslow's hierarchy of needs. You know, there are basic needs that we need to get right before we can develop and fulfill people's potential. And part of those basic needs is health, safety and well-being. So again, the focus of today's, but if you'd like more information, that is one of the downloads. So it would be great, Chloe, if you can launch our first poll. And it'd be really lovely to hear from our audience today. And you can tick all that apply, and we'd really like to hear from you. What do you think are the anticipated benefits from implementing a management system like ISO 45001 on occupational health and safety? So is it maybe reducing accidents, improving compliance, improving internal business confidence, and maybe external business confidence, improving employee and customer satisfaction, and improving business reputation? So just while you vote on that, I'm going to pre-warn our JC and Michael. So JC, I'm going to come to you first, and I'd really like you to kick us off and kind of explain what you feel you know, safety performance means to you, and what the factors are that will determine safety performance. And then Michael, I'll come to you and kick us off straight away with one of the kind of the juicy questions that I know that you'll be more than willing to talk about, and that's kind of the relationship between management system standards and implementing and conforming to those, and legislative requirements. So just so you're pre-warned on that. So have we got the results? Lovely, wonderful. So I think, yeah, so this is a really interesting mix. Quite high percentages. You're all saying that management standards hopefully will deliver all of these benefits, and we'll explore that in more detail. So wonderful. Thank you very much. So let's get on into the discussion. So JC, what does safety performance mean to you, and what do you think the kind of key factors are?
Thanks, Kate, and a very good day to everybody who's on the call. Thank you for joining this. I hope you're able to hear me clearly, Kate.
Yes, very clearly. Thank you.
Okay, great. Thanks for kicking this off, and thanks for having me here. Safety performance. Well, I guess if one were to talk about safety performance, we need to firstly understand what safety is, and then we talk about safety performance in the context of, I would assume, occupational health and safety. So we can go by the official definition, which talks about safety being all about keeping people free from injuries and illnesses, and also about the provision of safe workplaces so that people are safe, which to me translates differently. And to me, it's all about the provision of the necessary controls and the ability of people to kind of manage within those controls, which is why I'd like to say, and you talked about prioritizing people, and to me, that's absolutely critical. And I think prioritizing people means about raising the competency level of people to enable them to manage and operate in a risk-free environment. And that translates to, I would say, people competency. And the third thing, and I know Michael, this is one of Michael's favorite subjects. It's about capacity, because especially in today's world, I think we all recognize safety is not just about business as usual, but it's about facing all of those challenges day in and day out, and our ability to kind of be resilient to those challenges. How quickly can we bounce back when we have an event, whether it be a pandemic or whether it be a safety incident in the workplace, but how quickly can we really bounce back from that and be resilient? And that's where I would believe it's the capacity of an organization to bounce back which matters. So to summarize, and this is where I come to the 3 C's, which is it's really about controls, the controls that an organization has to ensure that it's going to be providing a safe workplace. B, it's about the capacity that an organization has to be resilient to bounce back in the event of incidents and accidents and calamities around you. And third, and I would say most importantly, about people and the competency of the people. So that's where the 3 C's that I like to use come from.
And I think that's a really great way of framing it, actually, and articulating it. Thank you, JC. So Michael, welcome. Lovely to see you.
Hello, Kate, and apologies to you and the audience for being late, but I'm glad I'm here.
That's all right. I'm thrilled that you were able to join us. So yeah, so it'd be lovely to hear from you and kind of get your view in terms of this relationship between implementing and conforming to a management system and the relationship with compliance with legislation. I'm very careful, and I'll just take the moment to mention, you'll notice the language. You conform to a standard and you comply with the legislation. Over to you, Michael.
Well, I mean, the starting point is to understand that in most jurisdictions, the approach of the occupational health and safety legislation is to impose a performance-based standard through a duty of care. That's the case in the UK, it's the case in Singapore where JC is, it's the case in Australia where I am, Malaysia, Indonesia, and various countries that really have adopted the international approach set out by the ILO Convention in relation to the legislation. It's also the case in the US, but I'll say something more about the US in a moment. And because of that, any approach that reduces the likelihood of an incident, particularly a serious incident or a fatal incident, has the benefit of reducing the likelihood of prosecution and therefore compliance and avoiding liability. So that's your starting point. So anything that you do that has a benefit in reducing serious accidents has a benefit from a litigation and a liability perspective. But when it comes to SMSs, there is something even further of benefit, and that is the proactive approach of the legislation requires a systematic approach to the identification and management and closing out of controls and verification of those controls in the workplace in terms of the risks that exist in the workplace. So implicit in the duty of care is this expectation that you will systematically manage the risks in your workplace, and therefore the existence and the implementation of a safety management system becomes, if in and of itself, a defence to any prosecution that is brought, particularly in jurisdictions where the duty of care arrangements and the approach is enforcement through a regulator bringing a prosecution for breach of the duty of care, but also it is also part of the obligations of senior managers in terms of exercising their due diligence to manage the company. This is particularly an issue in jurisdictions like the United States, where there is a high risk, in addition to the prosecutions by OSHA, the regulator in the United States. There's also a risk of class actions, civil claims being brought, particularly by activist shareholders, against the management team for neglecting the management of the company and reducing the shareholder value as a result. So you need to then show how you have manage the risks in your organisation. And one effective way of doing that is through having in place and implementing a safety management system. Now, in order for any of those defences to work, that system has to comply, has to conform to adopt that distinction that you quite rightly make with the relevant international standard in relation to safety management systems. So you don't get to pick and choose how you structure a safety management system. If there is a prevalent way in which that is done and that is an accepted way through an international standard, then that would be the standard in which your system needs to conform with, and then you would audit your system against that standard as a way of showing those defences that I mentioned, either against prosecutions or civil claims. So it works on multiple levels, and you know, building on what JC has said, because a safety management system has that benefit in promoting safety outcomes in your organisation, it also has that benefit of avoiding liability, both in terms of prosecution and civil.
Yeah, great, thank you. So I suppose lots of things are kind of, and I'll go on that, but maybe coming back to JC and your piece about Michael, kind of the focus on top management and the role of senior leaders. I mean, I think that's really important, and certainly that's a key element of 45001. It goes much further than any of the other international standards about actually focus and leaders taking that kind of demonstrable, proactive approach. So, JC, I was thinking about from the competency point of view. Kind of what level of competency should we expect for our senior managers in terms of understanding? I mean, corporate risk, you'd hope, as an overarching piece, but really understanding health and safety risk. What's the kind of the balance there, do you think?
Okay, I want to step back a little bit to answer the question a little more broadly, because I think let's go back to how safety management standards, the standards in general, are developed. I shouldn't be preaching to BSI here because you're the ones who do a lot of this, but it's really all about consensus, right? So it's all about a lot of people coming together, a lot of, in this case, countries and institutions coming together to come up with a consensus standard. So it is a lot of good business practices or common sense, let's say, that's put into a standard. But once that's done, we also need to be cognizant of the fact that this standard eventually needs to apply globally to organizations of every size. It could be for a small organization, for a large organization. So it's got to be flexible enough to be adaptable, so you don't have that much of a prescription. So there's a lot of language there, which will probably tell you what makes good business sense and what you should be doing because it makes good business sense. But it leaves it to some degree of interpretation to say that what is it my organization wants to do to comply with this. And that's where I'm coming back to the leadership competency, because if you are a leader who wants to say that, look, I want to do the bare minimum to just comply with the requirements of the standard and tick the box, then maybe you're not a very good leader. But on the other hand, if you say that I understand the intent of what this requirement is stipulating, and I need to go way beyond what it is and see how I can take my organization to the next level, using this as maybe just a base. I don't look at this as the ultimate achievement of the high level of safety performance, but I look at this as the base, and I want to build on top of this, and I have the necessary competence to know that what's the meaning of this requirement here that I need to kind of fulfill, and how can I take it to the next level. So that's where I think leadership plays a huge role, because I can, as a leader, take a very minimalistic approach and say that I am in compliance, and I can probably get, I mean, a certification body to come and say likewise, but that's not what I want to do. Because if I'm really, truly, and seriously committed about providing a safe workplace, I should probably go beyond that. And that's where I think leadership plays a big role.
I think it's so critical, and I think it's still so often overlooked. And you know, I still see, and certainly when I was a regulator, I saw it all the time. You know, the CEO thinking they've done their part by signing the health and safety policy, and you know that simply isn't good enough. You know, from a legislative point of view, I work for a regulator, so I have that understanding, and certainly not from what the management system is seeking, because it's seeking that cultural change that is driven from leadership. So I suppose,
Do you mind if I ask a question of Michael in relation to this?
Yeah, go for it.
So Michael, you spoke about you know, the implementation of the standard giving a certain degree of so-called legal defense. Have you, in your legal practice, come across organizations who probably hadn't implemented one and got into trouble with regulators? And maybe Kate, you can jump in too. And likewise, have you, on the other hand, seen organizations who put in place a good system and therefore got away with it lightly?
Yeah, and a third category where people had systems that they hadn't implemented, where they in fact were found wanting. So really, some of the more serious cases that I've seen in my practice, and where directors and senior managers have actually gone to jail for a significant amount of time, have been situations where a fatal incident has occurred, where there was no safety management system in place. And the court will often make a point of saying, in fact, that the absence of the safety management system is why a significant custodial sentence needs to be imposed, because it shows a complete disregard for safety. And one of the important things about safety management systems, particularly those pegged against international standards, 45001 in particular, is that it's a signal that you have the intention to provide a safe workplace, and then through the implementation of that, that's the commitment to the compliance. So by having the system in place, you're already starting the conversation. By implementing it, you are showing the compliance. And that's why I mentioned the third category, which is that it's not just enough to have a system. You have to have a system. You have to implement the system. You have to build up the capacity within the organisation, so that you are, in fact, continuously improving the performance of the system and the safety performance in your organisation. And this is where audit trails become important, where you actually audit the implementation of the system, and to both show conformance with the system, but also year-to-year improvement in performance as a whole. And yes, absolutely, I've seen in many cases, in many matters in which I have acted, the existence of a system becomes the defence where a prosecution is brought. But it becomes quite clear that the organisation did everything reasonably practicable in the circumstances, and its main strategy of showing it did everything reasonably practicable is to show that it had an effective safety management system. So these are important components, Josine. I think you make a very valid point in your question. These are important components of the overall strategy. But what I want to emphasise is, and I'm sure all three of us agree with this, is that it's not just having a system. It's not just having a paper system. It's actually living and breathing the system and implementing it in practice, and continuous and being vigilant in terms of enforcing the system. That's where the magic happens from a legal compliance perspective.
Yeah, absolutely, and certainly from my experience, particularly as a regulator, I lost count of the number of times that I'd go into a site and I'd ask to see how they manage health and safety, and they'd reach up to a shelf somewhere, and they pull down this big volume of paperwork and they dust it off and go, oh, here you go. And of course, that's completely missing the point. And I think this is one of the exciting things about kind of the evolution of 18,001 into 45,001, the international standards, because in 18 they talked about procedures. So it kind of drove this sort of mentality about having some paperwork to demonstrate what you're doing. 45,001, yes, you need to demonstrate some evidence of some of these things, but it's process. And one of the things that certainly from an auditing point of view for those organizations that kind of either you'll do it internally, but from a certification point of view, that actuaries, what we are looking for is the effectiveness of the system in practice. You know, again, coming back to, it doesn't matter how lovely that, you know, that health and safety policy is, if it doesn't mean anything in terms of what's going on site, then it's completely pointless, and it's not achieving what we're all want to achieve, which is actually protecting people. So yeah, so I definitely agree with that.
And, one of the things, and just building on that, Kate, I mean, I'd be interested in JC's views on this. You know, I was quite taken by the 3 Cs model, because I think one of the things that you emphasise, and obviously it's something that fits into the comments that all 3 of us have made, is the idea that you need confidence in order to build confidence in the system. And to build that capacity in the system. I'd just be interested in getting your perspective, elaborating how do we measure that confidence, and how do we verify that confidence, and why do you see that as a big component of an overall effective safety management system?
Okay, so when it comes to managing risks, which is probably what we're trying to do with a good system, it's really, as we always say, it's about the hierarchy of controls that you put in place, which I think is fine. Obviously, as far as possible, we should try and eliminate those hazards, or at the very minimum, at the bottom of the thread. For those of you who are familiar with the hierarchy, you know that personal protective equipment forms the last layer of protection for you know, managing hazards and risks. Having said all of that, I think what we miss is that aspect of the individual and the risk competence of that individual, which I think is probably the greatest metric that's possibly one should measure if they don't have anything else to do. Because end of the day, I may not have controls. I may not have all of those controls in place, or for whatever reason, those controls failed. So the last line of defense to me is not the PPE. It's that individual and the risk competence that an individual possesses or doesn't possess that's going to determine whether he's going to say, he or she is going to stay away from harm's way. So it is a broad topic, because competence is not a one-off thing where you can measure and say I'm competent or not competent. So having a certification is probably not just enough. Having a certificate to say that I passed a particular course is not sufficient. But do I really understand the nuances of my job, the hazards associated with each of these things? What are the possible risks that I'm going to be encountering? And do I have that quote unquote risk competence, so that in the event everything else goes wrong, I can stay away from trouble, and I can ensure that the organization gets away from trouble and nothing fails. So that's where I put competence as a friend, because I think that's the last line of defense, and something which everybody should have, because even for operating those controls, even for putting the PPE the right way, even for ensuring that I shouldn't be doing a process in a particular way, it's the human competence that's driving all of these actions. So to me, I think it's often, I would say it's to some degree an ignored aspect, which needs far more attention.
Yeah, it's interesting, and if I may, Kate, I think one of the interesting distinctions in my mind between the discussion we're having and what sometimes people hear when we're having this discussion, when they hear safety management system, they think bureaucracy, they think documents, and I love what JC just said, because he's talking about capacity, he's talking about competence, he's talking about the real organizational factors in terms of having a real system that is functioning and working. And I know all 3 of us have had these discussions in the past. I mean, although we're talking about safety management systems as a way of reducing accidents, the better way of thinking about safety is as the capacity for things to go right in the organisation. And actually, safety management systems increase your capacity for things to go right in the organisation, provided it's actually about real safety and not just a collection of paper and paperwork. And I think that's an important distinction that for our audience, certainly that haven't heard the 3 of us talk before, you know, for them to make that distinction in their mind between a real safety management system and just a paper system. And I think that's what's implicit in what you're saying, Kate, when you said, you know, I go see somebody and they give me the system from the shelf. Well, it's actually not a system. That's just a bunch of policies in a folder, right?
Yeah. I think you're right, and I think that kind of I'm keeping an eye on the questions, and we will come to them, and it kind of addresses a couple of the questions we've had, and we'll come on to the specific question about the value of certification, and the certification isn't an option for everyone, it's voluntary in most cases, but we'll come back to that. But I think that piece about your using of the management system, because it is best practice to enable a proactive approach to get things right, and that is the key. What that looks like, how that is done will be specific to the organization. Whether you look at for a certification or not, using the tool because it is there to help your organization. I'm going to move us on to the next poll, and then I'll share some results of the Harvard Business Study that talks a little bit more about this. So if we can launch the second poll, please, and I'll just move on. Great, thank you. So it would be really great to hear from our audience about whether you've implemented 45001. So not certification, because again, the key part here is using the tool to get the benefit of it. So have you started to use it? Are you fully using it across the whole of your organization? Maybe you started to use it in one or two of your sites, not maybe all of your organization. You haven't started that journey, but you are planning to. Maybe you weren't considering using a best practice tool, but perhaps you're reconsidering now based on our conversation, or maybe you're still not planning to use that best practice tool. So it'd be really great to get your answers and hear where you are in terms of that journey, and then we will move on to looking at this brand new research that's been done by Harvard Business School, and we'll have a bit more of a discussion. We've got Gavin is very active on our chat. The other question that's come in, and maybe Peter and JC we can cover in the Q&A, is there any difference between top management and leadership? So top management is a particular phraseology that's used in the standards, but is there a difference between those two pieces? Great, so we've got the results in. So we've got a mix. So okay, so the majority of people on the call are recognise, hopefully, the benefits, or certainly are going on the journey to use the standards, or are there already. So that's fantastic, and we've got a few who maybe aren't yet persuaded. So let's carry on, and let's have a look at the results of the Harvard Business School study. So this was a study that was looking at the safety performance implications associated with using a management system standard, and they did it in the United States, and they were using OSAS 18001. And the reason for that was that we need to look at data about a long period of time in terms of the effectiveness of a management system. So 18001 has been around for a lot longer, and therefore the data is there. 45001 is new, and the data isn't there, the data set. So they were using 18001, and it's a bit too early to really look at this study, but hopefully it's something we'll go back and look at for 45001. So the study was looking to answer two main research questions. Did safer workplaces in the US get certified to 18001? And did certification to 18001 make US workplaces safer? It's a really interesting study, and the reason that the study was done in the US was the availability of data, and it's something potentially we're certainly exploring replicating in other parts of the world. But they do use management systems. They're not great take up in terms of management system, but they are used, and we had and the research team had access to, if you like, the regulators' data on incident performance. So in terms of the first question, did safer did safer workplaces in the US get certified to OSAS 18001? So the research looked at around 300 organisations that had been certified to thousands of other establishments that hadn't. And it found very clearly that safer workplaces became certified to 18001. And I think this is really a reflection of the conversation JC and Michael and I have had so far about the benefits of using a health and safety management system. It's about driving performance, and organisations who see the value of that and recognise that will take that next steps towards certification. So that came through very strongly, and we do see that kind of maturity. You know, we see organisations who maybe haven't taken a proactive approach to health and safety. They don't think about management systems. They're focused on minimum compliance and not the broader benefits. Once you start on that journey, then you know that you get this performance increase. So that came through very clearly in the study. And in terms of the second question about certification, and we'll have a debate about the value of certification in more detail, but in terms of the study, did certification to 18001 make US workplaces safer? And it was resoundingly clear, yes, it did, actually really significantly. So those organisations that were certified to 18001 reduced the number of illness and injury cases by 20% compared to a match sample for other organisations. That's huge. So it's not just, I think, you know, coming back to what's the value of certification, one of the key things is it continues to drive continuous improvement. You know, that is the focus. That is the reason why we come out and audit. A lot of organisations think, oh, you know, and I'm sure JC and Michael will comment on this, get the certificate, tick a box, that's all we need to do. And of course it's not. Certification is only the beginning of the journey, and the value of certification is driving that continual improvement, and that came through very clearly in the study. And as well as those injury cases, actually there was a similar performance improvement in terms of other sorts of injuries, so days away from work and job transfers, and other ill health cases, all the data that the regulator captures. So, you know, really clear evidence, will continue to do more, but really interesting. So JC and Michael, I mean, what are your thoughts having seen that evidence? Do you think it's powerful? Do we think we need to do more research?
I think it's very compelling. I mean, you would take a 20% improvement any day of the week, wouldn't you, in terms of your safety outcomes, and it really correlates with the discussion we're having before. Not only does the data, not only is the data compelling, it also correlates with kind of the theory that has been promoted in relation to the space, that systematically managing safety and implementing a safety management system is expected to have a benefit. And the fact that you can quantify that benefit to 20%, I think, is a compelling proposition.
What are your thoughts, JC?
Yeah, I certainly think it is very interesting data, and I think obviously if this is true, then it really reflects on the need for it. But I want to actually put the question back to you, Kate, because having been in the certification industry for many years, what I have seen a general trend around is the commoditization of certification, if you know what I mean. It's really about, as you said, as you alluded to, the point that people just want the certificate for the sake of the certificate. So what is it that we can do as organizations or even as society to see that? How do we prevent that commoditization, and how do you ensure that there's a little bit of seriousness behind what's being implemented, and not just because it's a compliance requirement? So I think this is a challenge that we could address, because I think that the 20 may actually be 40 in the case of serious organizations, and in the case of organizations which have commoditized the certificate, or maybe quote unquote just gone for it, heck of it, it's probably not even anywhere close to 20. It's probably flat or even negative in some cases if they are not serious. So how do we prevent that commoditization?
I mean, I think that, I mean, it's a great question, and I think it's a challenge. And you touched on it from a competency point of view. You know, this view that a certificate, a piece of paper, somehow relates to actually a positive outcome. You know, and the same from a training point of view. You know, just because you go on a training course doesn't mean you're competent. The same can be true for certification, without a doubt. And we do see, you know, we see down supply chains, organisations that want to kind of have reassurance and assurance that, you know, the people that they're working with are doing the right thing. A way of seeking that is to get certification, third party independent oversight that organizations are doing the right thing. And therefore you kind of get this mentality about, oh well, I need to make sure I have that, I need to tick that box. But again, that comes back to me, the real value of certification. You know, certainly from BSI's point of view, you know, we are there to look to see that it is delivering what it is there to deliver, which is not only to prevent injury and ill health, but to proactively create a safe and healthy work environment. And if there is not evidence of that, and there is not evidence of continuous improvement, then we won't recertify you. It's this as simple as that. You know, a kind of a static approach. Oh, we've got the certificate, we don't need to do anything else. Well, that's completely missing the point of the management system and the value of it. And I think, you know, that's one of the reasons why choosing the right partner for certification, you know, we've got some really powerful results about certification, but it's not right for every organization. You know, use the best practice. That would, you know, whether you get certification or not is a different discussion. You know, lots of reasons for that. But if you use it, but if you do look for certification, you know, actually that's why it's so important to choose the right certification body, one who's got the integrity, one who is, so you may be aware, or maybe not be aware, that, you know, certification bodies should be accredited. There are non-accredited certification bodies, and accreditation is really important because accreditation is an integrity, a quality management system that we have to demonstrate that we are being demonstrating that integrity when we go out, that we are demonstrating and keeping the value of those management systems to drive performance. You know, so it covers things like about ensuring that we've got the competency and capability within our audit teams to ask those questions, and make sure that they're delivering and understanding the sector. So, you know, it's really important, and we all have a responsibility to drive that.
And if I can just jump in here, and I mean, from my perspective, it's important for us to understand and appreciate what an audit outcome through and therefore a certification is and what it's not. I mean, what you're trying to do when you come in and do an audit and then give a result through a certificate that says that you have conformed with the relevant standard is that after a series of inquiries by the certifying authority on a particular day, the system had been found to have either met the elements of the standard or hadn't met the elements of the standard. And depending on how the quality of that exercise, that can be quite an involved process, or as Josie has alluded to, you know, and we've all experienced it, sometimes, you know, that's been commodified and it's not as thorough as it should be. But the certificate itself, in my mind, that's the outcome of a process. The value is in the process itself. The value is in the conversations that take place when people are verifying against the elements. And too often people focus on the outcome and not on the process, both in terms of preparation, but also the conversations that take place, and the hazards that are identified, the suggestions from the certifying authority in the audit, the recommendations that go beyond the mere compliance with a particular element of the standard. That's, I think, what's more interesting in my view. And we seem to get hung up on a piece of paper, which again, if I bring us back to the earlier conversation, safety management systems should not be about paperwork, and the certification process should not also be about the paperwork. It should be about the engagement with the issues, and again, that if that provides a framework for an organisation to go through that journey with a competent auditor to get the certificate, I think it's a positive thing. But one shouldn't focus on the outcome as the be all and end all. They should focus on the improvement through the process, in my view.
I mean, you know, it's great to hear that summarised, and I think, you know, I've been audited. I've been an auditor, and obviously now work for a certification body, and that is the value, actually, that interaction, that questioning, that dialogue, what's going on. And you know, the auditors are going out to multiple organisations, often across multiple sectors, and they bring all of that experience and knowledge to your organisation, you know, and they can help you drive that continuous improvement, you know, and things. I mean, you know, talking about legislation, sometimes organisations miss that there's maybe a change in legislation, you know, and it's auditors that will be looking at that. Did you notice that there's been a change in regulation? What have you done about it? How are you managing that? And it is very much that dialogue, you know, and that continuous learning that is driven as part of that dialogue. I'm conscious, sort of, JC,
So
maybe
yeah,
whatever you wanted to add, but also we've had a question about sort of engagement with the workforce, and how do you get that? Maybe you could answer that, as well as what other comments you'd like to contribute. Thank you.
Can you repeat the question?
So we've had a question about how do you get the commitment and participation of the workforce?
Okay, great. So coming back to the points we've had discussion about auditing agencies, yes, it's really about competence eventually, because here we're talking about the competence of the auditor that plays a big role. Because, and to some of the points that you made, it's really not just about looking at whether an organization has put in place the systems. I always like to say that, you know, in early stages of a system implementation, yes, you want to go back and see whether the system has been put in place, in other words, whether the organization has worked for the systems. But eventually, you probably got to start looking at, is the system working for the organization? Because if the system is not working for the organization, then something's wrong with the way you put the system in place. So I think these are the two things. And when it comes to the system working for the organization, let me jump to the question now. It is not about going and sitting in a conference room and looking at a bunch of papers to say, is the system working? It's about engaging every level of the workforce and having that Gemba walks, or the factory walks, or the floor walks, or whatever you want to call it, and talking to people, not stopping somebody and saying, tell me what your quality policy is, but trying to understand from them whether they really know what's going on, whether they are conscious of the kind of hazards they are likely to be exposed to, and whether they have the necessary controls capacity and competence to manage those risks. It's about talking to people and finding out all of those things. So I think engaging people, if you're talking about it from a certification body point of view, it's really about speaking to a wider variety of people. And then even the 45,000 standard talks about the need for employee participation, right? It talks about employee participation and contribution of employee towards the development of the systems. So we need to make that not a paper exercise, but we need to really figure out, is this happening in the real life? Is this something which are we actually getting involvement of our people in the development of our systems? To what extent is this representing the views of the entire population? Are we lopsided in the views that we're getting? So those are all questions, I think, which an organization should ask themselves honestly, to see whether it is really genuinely being driven from the ground, or whether it's a top-down driven system that's being pushed down for the purpose of maybe satisfying a certification body or anybody else.
And I think you know, it's another area that's often overlooked. And you know, we often talk about safety culture, but actually it's about the culture of the whole organization, and how you engage with your people, how you make them feel valued, how you listen, how you hear what they have to say, how you take their experience, because they're the ones who are doing the job day in and day out. They know what works, they know what doesn't. If you're not listening, if you're not proactively engaging, and taking action on that, then again, you're not only going to be missing the point of 45,001, because this is a huge focus of it, but actually you're not going to be driving that best practice. You're not going to be driving that continual improvement. You know, I again, you know, experience over the years. I've had many times when, you know, somebody sat in an office and written a procedure, a process, an SOP, standard operating process, without engaging the people who are actually using it. And then, you know, there's this really often bureaucratic, unworkable system, because somebody thought it was a good idea rather than actually what goes on practice. So, you know, that engagement with your workforce, and really importantly, really inclusive engagement. I think this is the other thing that we see and starts to present some challenges for an organization. You know, maybe if you're unionized or you've got representation or a safety committee, it's often of a particular type of person within your organization. It's not necessarily representative of the entire workforce on all the different roles. So, you know, does your consultation with your workforce actually get involvement from a diversity inclusion point of view? So, you know, is it representative of women? Is it representative people of different race? Is it different representative people who might have other vulnerabilities, you know, those who might have hidden or visible disabilities? You know, actually, how are you doing that to make sure that it is representative? And I've got a question coming through. I'm conscious of time and scanning the questions. A great question, I think, for you, Michael. And maybe as part of this, actually, it was Peter asked the same question, the kind of the leadership stroke top management question. Are they one and the same, or is it something different? And the specific question, who bears final responsibility for a health and safety management system?
Well, I mean, it's an interesting question. The starting point is safety is everyone's responsibility. So what we would say is that everyone has a role to play in creating the environment for there to be a safe workplace. But ultimately, like any other management program that is put in place, whether it's financial management or it's accounting, whether it is performance management, operational management, it's about the leadership of the organisation and the ability to deploy resources to enable the workforce to achieve the outcome. So really, any safety management system relies heavily on the commitment and leadership of the organisation. 45,001 actually specifically has elements that deal with that issue, which I think is an important aspect of the system itself. And actually, one of the powerful things about it is that by following that holistic program, then you put yourself in a better position to show as a leader that you have exercised the type of diligence that would be expected of you in that role, which is the safety leadership that we would expect of our leaders.
Right, thank you. And just while we kind of finish the last few questions, if we can launch the last poll, obviously very interested in this. So we heard kind of where people were on the implementation. Somebody's asked the question, what's kind of, I mentioned about kind of fully implemented or partially. So the way certainly for certification, and quite often this is the journey that people go on for implementing a management system. If they've got multiple sites and maybe across multiple jurisdictions, they'll often start with one site, maybe the head office or a particular manufacturing site, and they'll start their journey there. They'll implement the management system. That might be the first site to get certification before rolling it out. So when I talk about kind of implementation or certification across all sites or partially, as this poll is, then that's what I mean. It's maybe you've got multiple sites, but you've only started your journey so far, maybe in one particular site. So really interested now to hear. We've obviously got an indication from implementation, use of best practice standards. But really interesting to see how many of you and your organisations have sought certification for 45,001. So again, the similar range of questions. You know, your entire site, entire organisation, all your sites are certified. You're on that journey. You've maybe done some, but not all yet. you haven't got any certification, but you are planning. You weren't planning on doing looking at certification, but having listened to today's webinar, you're reconsidering that, or you have no plans for certification. And that's going to bring us up to the end of the session. Michael, JC, I'll give you the opportunity for sort of like a 10-second final thought before I draw us to a close. Thank you. That's interesting again in terms of the range. So JC, final thoughts for us before we close.
I would say that it's all about people. So whichever journey you're embarking on, put your people first and make sure they know why they're doing what they're doing. And if they are aware of that, I think they are likely to support you in all your initiatives.
Lovely, thank you. Michael.
I want to piggyback off a comment that you made, which is it's about how work is done, not about the theory of how work should be done. And for that, there needs to be true engagement with the workforce and a ground-up perspective, which I think supports what JC is saying. So just remember, it's about the actual practicalities and realities. This is not a bureaucratic exercise, and it's about building capacity in the organisation.
Wonderful. Thank you. Thank you, JC. Thank you, Michael. Thank you for our audience for listening. We hope that you've been and found it informative. There's a short feedback session survey. Really appreciate feedback on the content of this session. If you want to know more about the research, then the links are here. You'll get a copy of this recording and links to the research next week in the follow-up email. So without further ado, thank you everyone and enjoy the rest of your day. Goodbye.
Thank you, Kate. Thank you, Michael.
Thank you. Thank you both.